Hello everybody, my name is Michelle Smith and I'm a Communications Officer from Merton Council. I'd like to welcome you to this latest COVID-19 support webinar. We're doing this one in anticipation of the openings indoors on May the 17th. And we've got people here who are going to give you some guidance and hopefully answer the questions on how things change as we go to step 3 and welcoming people back into premises. We have Maria Dane, who's an environmental health practitioner, and Ravina Purwell, who's an environmental services officer. She will be actually giving you the presentation today. We've also got Russ Stevens, who's a licensing officer, all from the Regulatory Service Partnership, or the RSP. So I'll hand you over to Ravina to start the presentation.
Thank you very much, Michelle. So I'll just start by sharing my screen and then confirm that you can all see it. So can somebody just confirm that they can see that, Maria?
Yeah, that's absolutely fine, Ravina.
Perfect, thank you. So Michelle's already kindly introduced us all, and we're all here from the RSP. I'll just start by a bit of a welcome. So welcome to the event, and thank you for attending today. As Michelle stated, we have a host of council officers here to answer your questions. The webinar is being recorded and will be published after the event on the council websites in each borough. All attendees other than the panel are muted. After the initial presentation, we will give you an opportunity to ask questions. If so, please use the virtual hand. And then when I say your name, a member of the event team will unmute you. If you do speak, it will be good if you could turn your camera on, but don't worry if you can't. And also throughout the presentation, please feel free to use the chat to share your views or ask any questions, and we'll try and answer them as we go along as well. All attendees have been sent the event etiquette, reminding them of the need to be respectful of all speakers. We are sure we won't need to, but if we do need to mute or remove participants, the event staff will do so. If there are any problems, we will communicate with individuals via the chat or by inviting them into an adjoining virtual discussion. After the event, attendees will be emailed any relevant links or information shared at this webinar, including a copy of the presentation used. So, as Michelle mentioned, myself, Maria and Russ are all officers from the RSP. So the RSP is a Regulatory Services Partnership, and we provide the environmental health function for the London boroughs of Merton, Richmond upon Thames and Wandsworth. So we cover areas such as food hygiene and food standards, health and safety, licensing, pollution and trading standards. And now we're doing a lot of work around COVID-19. So doing things like these webinars to support businesses with the guidance and legislation in place to control the transmission of COVID-19 and investigating outbreaks of COVID-19 in the workplace. So this is just an overview of today's webinar. So I'm going to start by talking about step 3 of the roadmap. So what are the changes from Monday the 17th of May regarding indoor dining in particular? And then I'm going to go through risk assessments and COVID-19 control measures. So things like ventilation, face coverings and social distancing. Then I'm going to talk about the NHS test and trace, which is mainly QR codes. Then quickly cover COVID-19 testing. And then finally, I don't aim to talk for more than half an hour or 40 minutes. And then finally, we'll move on to the question and answer session. So yes, I'll begin now then. So step 3 of the roadmap. So the government confirmed on Monday that step 3 can commence from Monday the 17th of May. So indoor areas of hospitality venues are now able to open. So the gathering limits in indoor areas of your premises are a group of up to 6 individuals or a group of 2 households. And when we talk about households, a support bubble is counted as a household. More guidance on support bubbles is available online, exactly what a support bubble is. And then outdoor areas of your premises can now allow groups of up to 30 individuals. If you are allowing groups of up to 30 in your outdoor areas, any outdoor structures you have, such as marquees, they must be compliant with the 50% rule. So I'll talk about the 50% rule in more detail later on in the presentation, but that's just a good thing to know. If you are enclosing your outdoor areas, to make them weatherproof, so you're having 4 walls and a roof, then that area would be counted as indoors. So you'd have to stick to the having a group of 6 or a group of 2 households. But I'll go into more detail on that bit later on. Additionally, in COVID secure indoor venues or outside if they wish, you can host up to 30 people for life events. So we are waiting for more guidance on what the definition of a life event is. But at the moment, the examples given in the guidance are wedding receptions, wakes, christenings, and bar mitzvahs. So hopefully by Monday, that guidance is updated further. But if you do get queries about, say, a birthday party or any other kind of event that is not one of the 4 listed, then go back and check the guidance. You can always email us. And ultimately, if you are unsure, it's not listed anywhere, it would just mean that this event can't take place indoors, but it can still take place outdoors for up to 30 individuals. All venues that serve alcohol are required to provide table service. So food is ordered, eaten and paid for while sitting down. If a venue does not serve alcohol, customers can order at the counter, but they must be seated to consume their food. So that's a situation, for example, at like a McDonald's. You can go to the counter to order, but you must then sit down to order your food or take it home. And then alongside indoor hospitality, indoor attractions such as cinemas, theatres are also able to open from the 17th of May. The capacity of each venue is up to 1,000 people or 50% of the venue capacity, whichever figure is lower. And for large outdoor events, so this is things like concerts, outdoor cinemas and things like that, these can now take place for up to 4,000 people or 50% of the site capacity, whichever figure is lower. All indoor and outdoor events must be ticketed, and please refer to the Performing Arts Guidance, the Visitor Economy Guidance, or the Organised Events Guidance for more information. And if you are planning on holding a large organised event, please see your council website for specific guidance and planning advice. Just to make this clear, this guidance on the capacities and the reference for it to be ticketed refers to events. So as I said, the cinema, theatre performances, concerts, etc. If you are a restaurant or a bar or a pub, which majority on this webinar today are, you should determine your premises maximum capacity when carrying out your risk assessment. So you should think, how many people can I allow safely into my premises while adhering to the rules around social distancing, etc. So usually when you're laying out your tables, you'll be able to lay that out. There's no maximum limit or anything like that, or 50% venue capacity limit for restaurants, bars, pubs, etc. It's down to you to determine that figure. Just a quick slide about outbreaks. So I'm going to talk more about COVID-19 risk assessments in just a minute, but as part of your COVID-19 risk assessment, you should consider an outbreak control plan. An outbreak is defined as 2 or more confirmed cases of COVID-19 among workers or visitors to a workplace within 14 days. If in the event of an outbreak at your premises, you should contact the London Coronavirus Response Cell. So I've put the telephone and the email address for what we refer to as LCRC here, and you'll be able to access this when the slideshow is emailed round. And then at that point, the LCRC will provide you with any guidance of what you need to do around cleaning, isolation, etc. at that point. So the first thing you just need to do is, in the event of an outbreak, is get in contact with them as soon as possible. As part of your outbreak control plan, you should really designate a member of staff who is able to contact them. So now I'm going to go into risk assessments and all the control measures for COVID-19. And before doing so, I thought it would be quickly good to cover, because we want to know how to control the virus, just to quickly cover how it's transmitted. So the virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe heavily. These liquid particles are different sizes, ranging from larger respiratory droplets to smaller aerosols. And then another individual can then catch COVID-19 when these respiratory droplets or aerosols get into their mouth, nose, or eyes, which is much more likely to happen when people are in direct or close contact with each other. The virus can also spread when infected people sneeze, cough on, or touch surfaces or objects such as tables, doorknobs, and handrails, and then a non-infected person would then come along, and touch these contaminated surfaces, and then touch their eyes, nose, or mouth without having cleaned their hands first. So, COVID-19 risk assessments. As an employer, you have a legal responsibility to protect workers. To protect workers and others from risks to their health and safety, included from the risks of COVID-19. So COVID-19 is a hazard in the workplace and should be managed the same way as other workplace hazards. So just like you manage hazards such as working from height or slips, trips and falls, you should treat COVID-19 in the same way. So this includes completing a suitable and sufficient assessment of the risks of COVID-19 and identifying the control measures to manage that risk. So this is what we call a COVID-19 risk assessment. If you have more than 5 employees, you must record the findings of your risk assessment. If you have fewer than 5 employees, there's no legal requirement for you to record the finding of your risk assessment, but you might find it helpful to do so. I provided links here to the Merton Council website and also the Health and Safety Executive website, which provides a lot of guidance on how to carry out a risk assessment and also template risk assessments. On the HSE website, which I provided a link for in the previous slide, there's a document what to include in your COVID-19 risk assessment, which I think is very helpful. This is just a segment, this is just a copy from this document. So in this case, one of the hazards is getting or spreading coronavirus by not washing hands or not washing them adequately. And then it talks about, then you should think about who might be harmed and how. So there's workers, customers, contractors, etc. And then the control measures, how can I make sure people are washing their hands and washing them adequately? So the controls are providing water, soap and hand drying facilities at wash hand stations, providing information on how to wash hands properly and displaying posters, ensuring you have a sufficient number of wash hand basins and providing hand sanitizer on occasions where people can't wash their hands. And then also, once you've got them control measures in place, what further action do you need to take? So, for example, making sure that every morning the soap dispensers and sanitizers are all stocked up and things like that. So that's just an example. I do really recommend you looking at this document. And then now onto the control measures. So ventilation / fresh air. Ventilation should be used as a control measure to reduce the risk of aerosol transmission of COVID-19 in enclosed spaces. Ventilation is a very, very key control measure. At the moment, since the 12th of April, if any of you have been allowing customer seating, it's all been outdoors, so there's plenty of ventilation, there's plenty of fresh air. But now as we move indoors and allow customers to see indoors, it's very important that these indoor spaces are adequately ventilated. So there's different ways of providing ventilation. So there's natural ventilation, which relies on passive airflow through windows, doors, and air vents. So you should be keeping your windows, doors, and air vents fully or partially opened. Just please note that fire doors should not be wedged open. And also there's mechanical ventilation. So this is using ventilation systems and keeping them on at all times to bring fresh air from outside. You should look at your ventilation system specifications just to make sure they are bringing fresh air from outside. Some air conditioning units sometimes recirculate air and do not bring in a fresh air supply. So you should only be using these kind of air conditioning units alongside another means of ventilation, which is bringing in fresh air. For example, having the windows and doors open. So having the same air recirculated, it's not going to benefit us. We need to be bringing in fresh air, and you can use a combination of the two. So a combination of keeping the windows, doors, etc. open and having your ventilation systems running. There's a lot of guidance, and I've provided the link to it on the Health and Safety Executive website. And also, not just the areas where your customers are sitting down, you should think of all areas of the premises, so the toilets and staff rooms are sometimes missed as well. And now moving on to face coverings. So I'll start with the customers. So unless customers are exempt, customers are legally required to wear a face covering in various indoor settings in England. And one of these indoor settings are premises providing hospitality, so bars, pubs, restaurants and cafes, except when seated at a table to eat or drink. So if when people arrive when customers arrive at the premises and you're taking them to the table to be seated, unless they're exempt, then you're wearing a face covering. And it's only when they actually sit down they can take that face covering off. But if they need to get up again for any reason, so when they're leaving the premises or if they're going to the toilet, they should be reminded to put their face covering back on again. Businesses should take reasonable steps to encourage customer compliance, for example, through in-store communications or notices at the entrance. If necessary, police can issue fines to members of the public for non-compliance. We did some webinars previously and this query came up a lot. So some people do not have to wear a face covering. If somebody is exempt from wearing a face covering, they should not be denied entry for not wearing one. And what the query that came up is how do I prove that people are exempt? There's no legal requirement to carry around any kind of proof of exemption or anything like that. So if I come to your restaurant and I say I'm exempt, you have to take it at face value that I'm exempt and you have to allow me entry into your premises without wearing a face mask. And now face coverings for staff. So face coverings must be worn by retail, leisure and hospitality staff working in any indoor area that is open to the public and where they are likely to come into contact with a member of the public unless they have an exemption. Where face coverings are required for staff, businesses are expected to provide these as part of their health and safety obligations. However, staff are welcome to use their own face coverings if they choose. If businesses have taken steps to create a physical barrier or screen between workers and members of the public, then staff behind that barrier or screen will not be required to wear a face covering. So the example I like to use here is at the checkouts at supermarkets. A lot of the checkout staff are sitting behind a screen, so those checkout staff would not be required to wear a face covering. But if there was no screen there, then it is an area that is open to the public, or so therefore, and it's an indoor area, so therefore they'll be required to wear a face covering legally unless they're exempt. And also this talks about the legal requirement refers to indoor areas, but we put a note at the end here saying it's good practice for staff to continue to wear face coverings while working in outdoor areas to prevent them from frequently touching their masks when moving from indoor to outdoor areas. And also it's just very easy to forget when they're moving back indoors, forget to put their mask back on and then they're not wearing it properly. So that's face coverings for staff. So we've got this question a lot over the past year: face coverings versus face visors or shields. So a face visor or shield may be worn in addition to a face covering, but it should not be worn instead of one. This is because face visors or shields do not adequately cover the nose and mouth and do not filter airborne particles. So you should be wearing a face covering like a mask, which covers your mouth and nose adequately. A visor or shield can be worn on top, but it doesn't replace a face covering. Staff who are exempt from wearing a face covering. So if staff are exempt from wearing a face covering, they should wear a face visor if possible. And if they're unable to wear both a face covering or a face visor, you should encourage them to wear a badge advising customers that they're exempt. This is because this just makes customers feel more comfortable that staff and the business is not just blatantly choosing to ignore the rules. There is a genuine reason why this member of staff is not wearing a face covering, and also prevents us or the police from getting unnecessary complaints. And also, if staff are exempt, ideally they should not be working in customer facing roles, and where possible working back of house roles or behind a barrier or screen. So just going back to that supermarket example, if I wasn't working at a supermarket and I was exempt from wearing a face covering, it's not a good idea for me to work at the self checkouts where there's no screen for me to work around behind and I'm coming into contact with a lot of people. It'll be better for me to work in the warehouse at the back or at one of the counters, like the lottery counter or the checkout, where I can work behind a barrier or screen. So that's something for you to think about. And now moving on to social distancing. So the social distancing rules are: there should be a 2 metre distance between individuals, or where 2 metres is not viable for your business, this can be reduced to 1 metre plus risk mitigation. And when we talk about risk mitigation, there's some examples here. So further increasing the frequency of hand washing and surface cleaning, keeping the activity time involved as short as possible, using screens or barriers to separate people from each other, using back-to-back or side-to-side working / seating whenever possible, and reduce, and this last one's more applicable to staff, not customers, and reducing the number of people each person has contact with by using fixed teams or partnering, so each person works with only a few others. So you should use floor markings and signage to promote social distancing and ensure the appropriate distance, so 2 metres or 1 metre plus risk mitigation, is maintained between tables and customers and staff. In emergency situations such as fires, accidents, break-ins, and when administrating first aid, you do not have to maintain social distancing if it would be unsafe. But as soon as possible after the incident, anybody involved should follow personal hygiene advice as soon as possible. Just covering the social distancing aspect again, we've had a few queries. Do I still need to keep a distance between my table? So it's a legal requirement under the above mentioned legislation to keep an appropriate distance between tables occupied by different qualifying groups. So when we talk about appropriate distance, the legislation states at least 2 metres or at least 1 metre if there are measures in place, which are the risk mitigation measures. So measures in place that are that limit the risk of transmission of COVID-19. So things that we talked about in the previous slide. So the hand washing, keeping activity time as short as possible, using screens or barriers, using back-to-back or side-to-side working / seating. So yeah, just as a reminder, it's still a legal requirement for you to position your tables at least 2 metres apart or 1 metre plus risk mitigation. So cleaning, so ensure you have hand sanitizer available throughout the premises for customers and staff to use, in particular at the entrance and near hand contact surfaces, for example, next to the toilet door. You may wish to give staff their own personal hand sanitizer so that they don't need to worry about looking for a hand sanitizer point. They can sanitize their hands throughout the day and at any time. You should be cleaning all tables and chairs after each use, including any condiment bottles provided to the table, or you could use disposable sachets. Menus should also be cleaned after every sitting, after every customer's used it. So if a menu cannot be cleaned, so for example, they're not laminated, they should be single use, and anything else on the table, such as unused cutlery, etc., should also be cleaned. So alongside cleaning the table and any contents of the table after each use, you should be frequently cleaning what we refer to as frequently touched surfaces throughout the premises. So these are things like door handles, toilet flush handles, taps, the card machine. So you should have a member of staff constantly cleaning these frequently touched surfaces. So managing staff, so as mentioned previously, as mentioned briefly in the other slide about social distancing, staff should be maintaining social distancing guidelines throughout the premises. So this goes back to the fixed teams and partnering. So each staff member should work with the same few individuals on every shift. So for example, if I was a chef or if I was a waitress, or if I worked at a restaurant or bar, and I worked Monday, Wednesday and Friday, when I come in on Monday, Wednesday and Friday, I should be working with the same people, or as far as most reasonably practicable, the same people. And then it's very key for you to remind staff that social distancing applies to all parts of a business, all parts of the premises, including break rooms and canteen. And also in these areas, you should ensure that all the other control measures are being implemented. So ensuring these areas are well ventilated and also are being cleaned. You should also be minimising the contact between front of house workers and customers at the point of service where appropriate. So for example, using screens or tables, and to maintain social distancing guidelines. So now moving on to NHS test and trace. So it's a legal requirement for all hospitality venues to display a QR code poster, like I've got a picture of here. If you haven't got your poster or you've lost it or anything like that, the link is here for you to create a coronavirus NHS QR code for your venue. So you can just go on there and quickly create one and print one out. So once you've got the code, once you've got the poster printed out and on display in your premises, then what do you need to do? So the rules have changed since last time, so since pre-lockdown. So now you must ask every customer or visitor aged 16 and above to scan the NHS QR code. So previously, as you can see at the bottom in bold, there was a lead member provision. So that meant one member of the group could provide their details on behalf of the entire group. This lead member provision no longer applies, and every person over the age of 16 must be asked to scan the NHS QR code or provide their contact details. So say you've got a family of 4, 2 parents and 2 children. The children are 15 and below, so they won't need to check in, but both parents would need to provide their details. And if for any reason a customer cannot scan the NHS QR code, so for example, they might not have a smartphone, they might not have the NHS app downloaded, or their battery might have died, you must provide an alternative method to collect contact details, which doesn't require a smartphone. So you should record, the details you need to record are the name of the customer or visitor, a contact phone number for each customer or visitor, and the date of the visit, the arrival time, and where possible, the departure time. So you could get like a diary and keep these details in, and these details must be kept for 21 days. And alongside the customer details, you must keep a record of all staff working on the premises and the shift times on a given day and their contact details. And again, these details must be kept for 21 days and provided to the NHS test and trace if required. So when each customer comes into your premises, when they scan the QR code, that data goes directly to NHS test and trace. However, the people who don't scan the NHS QR code and whose details that you write down on their behalf, and also your staff shift patterns, you should keep these for 21 days, and it is your legal duty to share these details with NHS test and trace as soon as possible when asked. If you are asked and you do not have this information, you'll be liable to pay a £1,000 fine. And just as I mentioned before, note, you do not need to share information about those who have already checked in with the NHS QR code. Hospitality venues also have additional requirements and must take reasonable steps to refuse entry to anybody who refuses to either scan the NHS QR code or provide their details so you can write them down. This is just a hospitality fact sheet. It just quickly summarises what I've just said, so you can have this available to you once the slideshow is sent round. And this is not a legal requirement or anything like that. It's just a good practice. So it's good practice to have a member of staff working at the entrance, welcoming customers, checking they do not have any symptoms of COVID-19, advising them of the premises rules / expected customer behaviour. So this is things around wearing a face covering when you go to the toilet, etc. Asking customers to scan the NHS QR code or provide their contact details and sanitise their hands. And then once you've done that welcoming, then you can take them to their table. It's also a good practice to introduce a one-way system where possible, so people exiting the premises will not pass people who are entering the premises. So now we're going to quickly move on to COVID-19 testing. It's coming towards the end of the presentation now. So PCR test. So this is for anybody who has at least one of the 3 COVID-19 symptoms. So this is a high temperature. So the 3 symptoms are a high temperature, a new continuous cough, or a loss or change in an individual's sense of smell or taste. So if anybody does have any of the symptoms, any member of staff or anything like that, it's important that they isolate and get a PCR test, which can be booked through the following link. This test needs to be sent to the laboratory for testing, and you'll receive a result and the result will take 48 hours if you've gone to a test centre, or if they've chose to get the home test kit, the result will take 72 hours. So this is PCR test, so remember, for symptomatic anybody with symptoms, and then you've got what we call rapid lateral flow tests. So this is the main difference between PCR being for symptomatic and rapid lateral flow for people with no symptoms of coronavirus. So lateral flow testing is a fast and simple way to test people who do not have symptoms of COVID-19, but who may be still spreading the virus. 1 in 3 people with COVID-19 do not experience any symptoms and may be spreading the virus unwittingly. Since the rapid lateral flow testing was introduced, over 120,000 positive cases that would not have been found otherwise have already been identified. And that figure was correct as of the beginning of April 2021. So I can imagine that figure's a lot higher now. The best known example of a lateral flow test is the home pregnancy test kit. The tests are easy to use and give a result in less than 30 minutes, and they do not require a laboratory to process the test. Individuals who do test positive must immediately self-isolate to avoid passing on the virus to others and order a confirmatory PCR test. So you should encourage your staff. There's no legal requirement to do so, but you should encourage your staff to get lateral flow tests. So if they do have the virus but not any symptoms, this is picked up, and then they can isolate and then prevent them from spreading the virus any further. So there's 2 main ways that staff can get a lateral flow test. They can go onto the Merton, Wandsworth or Richmond Council website and book a lateral flow test. So the links are all available on this slide. Alternatively, staff can order a pack of 7 tests online to be delivered to their home address or collected from a participating pharmacy, and they can do these tests at home in their own time. And then just as you would read a pregnancy test, it's quite easy to read, as I mentioned in the previous slide, and then they can do that before coming into work. So that's oh, sorry about that, this has come up. So that covers testing really, but as I mentioned before, lateral flow testing, there's no legal requirement at the moment for staff to be completing lateral flow tests. So this is just a quick overview for toilets. So where possible, provide a source of ventilation. To provide a source of ventilation, keep the doors to the toilets open. If you are unable to keep the doors open for privacy reasons, ensure there is hand sanitizer available at the entrance to the toilet for customers to use before touching the door handles. Additionally, if you've got any windows inside the toilets, keep these open at all times to provide ventilation. And you also need to manage the queues to the toilets. If possible, encourage customers to queue outside, because obviously the outside is well ventilated, but ensure you're managing the queue to the toilet, and whilst queuing, people are maintaining social distancing. Some premises have put some stickers on the floor where people should be queuing, and so that people are queuing and maintaining social distancing. So outdoor shelters and marquees. This was something that was very key when places were reopening on the 12th of April. So when they were erecting any kind of structures in their outdoor areas, they had to be compliant with this rule. This is still important now. So if you're allowing up to 30 people in outdoor areas of your premises, you must ensure these structures are compliant. So this slide talks about the exact legislation, but I don't want to confuse you with talking about different legislation and giving you a list of everything you can't do. So you can refer to this slide if you want to later when the slideshow is sent round. But I thought it would be easier just to talk about what is allowed. So to be considered outdoors. To be considered outdoors, shelters, marquees, and other structures can have a roof, but at least 50% of the area of their walls must be open at all times. These must be permanent openings in the walls. A window/door passageway would not count as an opening. So just a few pictures. So this is a outdoor structure. This would not be compliant because it's got a roof, which is fine, but then because it's got a roof, more than 50% of the wall space has to be open. And you can see there that at least 75% is enclosed there. You've got this very small opening, and even then that's not a permanent opening. You can easily, in the event of bad weather, close that and it would be completely like an indoor, like a normal room, 4 walls and a roof. This again, This is quite popular at the moment. I've seen a lot of these on social media, these kind of igloos. These would not be compliant apart from that doorway. And as you know, doorways don't count. This would be completely enclosed. So although these have got big crosses next to it, if you've got anything similar to this, then you can only allow, it'd be classified as indoors. You can allow a group of 6 people or a group of 2 households. You can't, this is not classified as outdoors, so you can't have up to 30 people using these areas. Whereas something like this is completely compliant. It's got the roof, but it's got all the walls are open, so that's compliant. We would deem that as an outdoor area, so you can allow a group of up to 30 people to use this area. And the same again is this for this picture. It's got a roof and more than 50% of the wall space is open. So again, we would deem this as outdoors, and you can allow up to a group of 30 people to use this area. Just a quick point on smoking. If you are allowing smoking to take place in outdoor areas of your premises, you should have separate smoking and non-smoking areas. Clear no smoking signage should be displayed in designated areas, and there should be no ashtrays or similar receptacles in the smoke-free areas. And you should aim for a minimum of 2 meters, a 2-meter distance between non-smoking and smoking areas wherever possible. Venues will be prohibited from providing smoking equipment such as shisha pipes for use on the premises. That's just another point about shisha. This sign is available on the gov.uk website. The link to it is here, and it's called the COVID secure signage. So if you feel that you've if you've took the 5 steps that are on here, so for example, one of them is to carry out a COVID-19 risk assessment, you can sign this and date it and put it on display in your premises, and it's just something for you to show members of the public that you are taking it COVID-19 seriously, and you're doing everything you can to control the transmission of COVID-19 inside your premises. So the restaurant, pubs, bars and takeaway guidance is available on the gov.uk website. This is where I get all my information from. Most things that are in this webinar come from this guidance, and it's updated regularly. As you can see, it was just updated today on the 11th of May. So I strongly recommend that you keep referring to that in case any changes. And also on the Merton Council website, Michelle's produced a toolkit, and there's a lot of information on there. And also this webinar, once it's finished, a link to the recorded version will be available on here as well. In terms of business grants, etc., that's not our area of expertise, unfortunately, but I've provided the links to the Merton, Richmond and Wandsworth Council websites, and you'll be able to get some more information about the grants, etc., that are available to you. I'm now going to pass it on to my colleague Russ Stevens from the licensing team, and he's going to talk about the Ask Angela scheme.
Hi guys, thanks Ravina. Yeah, exciting times ahead. So hospitality venues all opening from Monday inside. I just want to say, start off with, this is a fresh start for many. You're going to have new members of staff, new customers at your premises. Many customers completely new to the concept of drinking in pubs and restaurants. So we need to ask you, please stay focused on your obligations under the Licensing Act as well. It's not all about COVID. You're obliged to promote the prevention of crime and disorder, promote the prevention of public nuisance, promote public safety and protect children from harm. It's still important that we keep our eyes on those as well. So we've got the Ask for Angela scheme. This is something that I introduced to Merton in 2016 when I was a police licensing officer, and it's been hugely successful and was rolled out over the entire London Met Police area as well, and it's all over the country and it's global as well. This is a poster campaign which gives you the opportunity to declare your commitment to the welfare of your customers. You basically put posters up in the toilets and in other areas where people can see that they can go to the bar or go to a member of staff or security and discreetly ask for assistance, and that they will be taken seriously. This is the important thing. Realistically, people most of the time won't actually ask for Angela, but there is this code word, so that if they were to come up to the bar and they could say, "Is Angela there, please?" then your staff should be trained enough to know that this is actually a request for assistance, and you take that person to maybe to the end of the bar, and you take them seriously. And it might be that they're sat with a person who's creeping them out, who's uncomfortable, who they're uncomfortable with, or someone that they're really unhappy with, and they need your assistance. It could be that you call them a cab. It could be that you provide them an exit from the pub or the premises without this other person knowing, or it could be that you call the police. And again, the police are fully aware of this, and they will take you seriously. So if you phone and you say, "Look, you've got a guy and a woman here, say, and you're unhappy with the way that the guy is with the woman, and you would like some sort of police intervention," then the police will take you seriously. That leads on to online dating as well, which is a big thing now. And you're going to have come across, there's going to be a number of situations now where people have formed relationships online throughout lockdown, and this is their first opportunity to actually meet people in a pub, in a restaurant. They will feel that they know each other really well because they may have been communicating for some time over the internet, but they are still meeting those people for the very first time in your premises. We're aware of a number of sexual and serious sexual offences that have been committed because you'll have people that feel that they are invested in their relationship with this person, and then it's not turned out to be how they'd hoped or how they believed it was going to be once inside your premises. So we need to ask your staff to be proactive, to look out for your customers, intervene when they can or when they think they should, and if they're uncomfortable with that, then call the police when necessary. And just to say that, we're all desperate to get back to normal and have a good time. There are obvious risks. People are going to be drinking more than they would have done prior to this moment. The risks are obvious, but we've also got to enjoy ourselves, and we've just got to be safe about it. So thanks very much, and good luck. Good luck on Monday. Thanks, Rin.
Thanks, Russ. There's some slides here just about what Russ has just spoke through for you to read through afterwards. And also just a few any other businesses at the end before we move to the question and answer session. So there's details here about the EU settlement scheme. So if you're employing or know an EU national, they need to act now to secure their rights in the UK. If they've lived in the UK before the 31st of December 2020, and then they are, or someone in their family is an EU citizen, they must apply to the EU settlement scheme before the 30th of June 2021. So this is just a list of the criteria when applications must be made, or if they don't need to apply. Alongside this presentation, we'll be sending a flyer and a referral form, because Citizens Advice Merton and Lambeth is supporting Merton residents with these applications. If you are a business based in Wandsworth or Richmond, I'll try and find similar support offered by Citizens Advice in these boroughs to send it out with you. And if not, then if I can't find anything, then I'll the best thing to do is to contact the number on the flyer, and hopefully they can provide you with advice for the neighbouring boroughs. So that's just and then final point, it's Mental Health Week at the moment, as you're all probably aware. We've spent many months at home, so it'll take some time to adjust to life after lockdown. To avoid burning out, make sure you're taking some time to look after yourself as you transition back into work. There's a link below from Mind, so you can use that for advice for the self-employed, from stress to anxiety support to nutrition and sleep tips. If you're welcoming staff back into the office, make sure you're looking after their well-being as well. The pandemic has affected everyone differently, so good communication and transparency is important. Merton Council and Richmond and Wandsworth are hosting various webinars, etc. Details of this will also be circulated after the webinar alongside the presentation and the other documents I've mentioned. So I think that's the end now of my presentation, and we'll move on to the questions now. But if you do think of anything post this webinar or in a few hours, even in a few days, please feel free to email us at foodandsafety@merton.gov.uk. We are here to help you, and we want you all to get everything right and succeed. So I'll move on to the chat. I think Maria has been answering everything as we've been going through.
Yeah, I think I've answered most questions. Just for clarity on childcare bubbles, that's different to support bubbles. So if you had the childcare bubble that's only used for childcare, so that would be two separate households. Just to clarify that, a support bubble would be linked with a household.
Oh, perfect. Thanks, Maria. If anybody has got any further questions, you can raise your hand and we'll unmute you, or you can add that to the chat. So we'll give it a few more minutes in case there's any other questions, and if not, then that'll be the end of today's webinar. But as mentioned, the email address is on the screen if you've got any further questions, and also all the details of this webinar will be emailed to you in the coming days.
I can't see any hands up. Can you, Ravi?
No, I can't see anything.
No.
So I think there's nothing further in the chat.
You've done a really good job covering everything.
Oh, well, I'm sure it wasn't. I'm sure there's still. I'm sure it wasn't that great. But yeah, but I think that's all for today. Then, if there's no other questions, so thanks very much for attending. I hope you all found it useful. And if you're not open already for outdoor dining, then good luck on Monday. And I'm sure you'll be seeing myself, Maria, and also our colleague, and also Russ, and also our colleague Sean, who works primarily in Richmond, out and about doing some checks and helping you really. Oh, we've got one more message in the chat. Oh, that's just a thank you. Oh, Pat from Merton Chamber, you've got your hand up, so I've just asked you to unmute.
Yes, hi, thank you. It was a very good presentation. I'm just curious if you have any summary with legal requirements that restaurants and hospitality places have to actually comply with, kind of like a checklist. So if they ask, okay, hang on, is that the legal requirements? If there is a list of legal requirements that they actually have to comply with.
If they go to the guidance, there's COVID guidance for pubs, restaurants and hospitality venues. They will clarify what is the shall and what is the must. So the shall, that it will be, and there's checklists all within the guidance. So each sector has their own sector-specific guidance. So that's the best place. The .gov is the best place to check for that. And we've got all the links on the Merton website toolkit as well. If people need to go there.
Fabulous. Thank you very much.
Thank you. Also, Steve's just asked the question about outside bars. Can people use it social distanced? So unfortunately, the table service rules still apply both indoors and outdoors. So people must, if your premises sells alcohol, people must order, eat and drink and pay while seated. There is a slight adjustment to that rule for the payment. So if for any reason your card machine or etc. wasn't working outside, people can go inside and get out of their seat to get up and pay. But ordering and eating and drinking in a venue that sells alcohol must be done while sitting down. But yeah, I think that's all then for today. I can't see any other hands. So yeah, thanks very much for attending, anyone. And if you've got any further queries,
Ravi, I think someone else.
Oh, sorry. Oh yeah, we'll just wait for that. It's from Luston.
Do you want to unmute Katrina?
Oh yeah, I'll just search for you, Katrina, in the. Yep, I've unmuted you, Katrina, so you can ask your.
Can you hear me now?
Yep, I can hear you.
Yes,
yep.
Yeah, sorry about it. It's definitely going to be quicker than typing it. So one big question, obviously last year, it was a royal mess for everyone. No one really knew what they're doing, but this time around, it sounds very much like last year, just with added face coverings. I'm kind of getting the idea right, I'm assuming.
Yeah.
So I mean, like last
COVID.
year, 4th of July opening just without a face covering. So same COVID safety prevention manuals, all of those things. I can still use the ones that I had last year because all the practices are still in place.
Yeah, we would advise that you just review everything just to make
Oh
sure.
yeah, of course. I've been
you
going
check the
through
guidance.
loads of bits and pieces. The other question is because I've seen this on a lot of occasions last year, so I wasn't entirely sure whether it was a case of nobody minding it or that being all right. How about people actually sitting at the bar?
They shouldn't be sitting at the bar. There's meant to be a barrier between staff working behind a bar and customers.
So, for example, if I got easily 1.5 meters without a doubt between somebody sitting in a corner of the bar where there's a closed off station where there's no service happening and bartender on the other end, is that still all right, or is that something that's completely...
It's table service. Russ, do you want to come in on here for the
license? Yeah, I'll just say, I mean, regardless of what the rules actually are, I mean, if you get a good lawyer behind it, you could probably prove that a section of the bar could possibly be legal. What you will find, though, is you will get a number of complaints, or rather the council and the police will get a number of complaints. And we've got to look at public perception over this.
Oh yeah, like
issues...
absolutely correctly. But again, as I mentioned before, the reason why I asked was because last year there was fair few bars that I went to myself, and I had a luxury of sitting at a bar and chatting with a person. And I know that those venues have carried on the same practices, and no one has seemed to bat an eye about it. So I understand that everyone's trying to do their jobs, and I'm not here to point fingers at other businesses. It's not the way
we were mopping up those complaints. We spent a hell of a lot of time going around to these premises because people were phoning us up, and we were going around talking to all of those as well. It has to be table service, and they have to be.
Oh yeah, absolutely. But what I more meant by it was.
Yeah. No, I get what you're saying.
So somebody sitting at the very corner of the bar where there's no staff around there for any given purpose, any good purpose, and someone off the floor is like, "Can I get you a drink?" And then put the drink through the till and the bartender makes it, and then I take it forward to them. But yeah, that answers my question. Thank you very much.
Cool. Thank you.
Thank you.
Thank you. So yeah, there's no other raised hands and no other questions in the chat. So that'll be all for today. Thanks again for attending, and we'll send out the details as soon as we can. And please email us if you've got any concerns. Thank you very much.
Thanks, Ravi. Bye.